Hi, everybody. Thanks for joining. We're just letting the room fill up a little bit, and then we'll start in a few minutes.
Hello, can you hear me okay?
Yes,
Okay.
Hi, Evelyn. It's
and
Hi.
Hello.
hello.
Evelyn is one of the two joining me, and Nick is on too, I see.
Okay, okay. Let's see. Going up here, we may. Okay, I think we will go ahead and get started. Welcome everyone to Research and Discovery Grand Rounds. My name is Bridget Jones. I'm a professor of pediatrics at Children's Mercy and co-lead translational endeavors and workforce heterogeneity within Frontiers. So I'm happy to be hosting Research and Discovery Grand Rounds today. We do have one housekeeping slide. You can go to the next slide. For our next Research and Discovery Grand Rounds, which will be January 23rd, where we'll have a speaker, Dr. Michelle Cotton from AHRQ, who will talk about the federal scientific review process. So please mark that on your calendars and come back and join us again. So today I'm really happy to introduce our speaker and our speaking team. So we have Dr. Emily Hurley, who's an associate professor in the Division of Health Services and Outcomes Research at Children's Mercy Research Institute. She's also the director of Children's Mercy's Formative Research team. She'll be joined today by Nick Schutz and Miss Evelyn Donis de Miranda, who are research associates with Formative Research. The team applies expertise in social and behavioral theories, qualitative interviews, focus groups, and rigorous survey development to conduct research that informs the design of new health interventions and enhances understanding of outcomes. So with that, I welcome the team and I will turn it over to Dr. Hurley.
Thank you so much. It's great to be here and to be joined by Evelyn and Nick, my colleagues on the Formative Research team at Children's Mercy. So at the Children's Mercy's Formative Research team, our mission is to promote the rigorous use of methods that can help us understand, amplify, and incorporate the patient voice or the community voice or the provider voice into health programs. And we have expertise in qualitative research, mixed methods research, applied social and behavioral sciences. So I just wanted to take a minute to introduce our team and what we do before we get into the talk. Our team is 5 people with expertise in the social behavioral sciences and in qualitative and mixed methods. Evelyn Donis de Miranda have been with us the longest since we started this team in 2019. We also have 3 other full-time members, Nick Schutz, Lynette Lardy, Nalubega Ross. They all have different expertise and different backgrounds, but together we collaborate with teams across the Frontiers institutions, mostly at Children's Mercy, but often outside. We do consultations for formative research and we do skill series training. So at the end, I'm going to talk about all of the resources of our team, but I just wanted to briefly introduce ourselves before I got into our outline. We are going to define formative research for those of you that haven't heard the term or aren't comfortable with the term yet. Talk a little bit about how you would go about conducting formative research. And formative research is often that starting point that lies on the path to establishing evidence-based interventions. So through an example of some of my work, I'm going to show you how formative research grows through the line of establishing evidence-based intervention and how it lines up with NIH funding mechanisms. We're going to give some more examples of formative research, and then, of course, point you to some resources that our team offers if you are conducting formative research or interested in learning about it some more. All right, I'm going to hand it over to Nick Schutz to start us off. He's going to talk about how we define formative research. Thanks, Nick.
Hi, everyone. Yeah, thanks, Emily, for that wonderful introduction. So yeah, I'm going to briefly go through kind of, not only what is formative research, but also what it is not, and kind of comparing it to some similar research approaches to compare and contrast them to give you a little bit of a better idea of what it entails. So generally, formative research refers to a systematic research approach that informs a health intervention. And this is usually to create a new intervention or improve an existing one. And this is all within a local context. But as the slide shows, there is not yet a single unified consensus on a definition. So other people might define it slightly differently, and there may be some variation, but generally speaking, that's kind of the primary crux of it. Next slide, please. So the way we define it and the way we kind of do formative research, again, it's really focused on health interventions or programs. So like that kind of has to be one of the main purposes or end goals for formative research that we do. For us, it's really important to really co-create the research project or the intervention. It's really important to consider all the perspectives of anyone who might interact with the intervention or program. And that includes people who might be the ones who deliver the intervention or program, and also those who might receive it. It's also important to ensure that the intervention is suitable for the setting and community, again, going back to that local context. Formative research can be conducted before, during, or after the intervention itself. When it's before, it can formative research can help design or plan or just generate an intervention that is tailored to the needs of the population. When it's during, that can help either pilot an intervention or think about the possibility of expanding an intervention later. You can test an intervention in a new setting or a population. You can test the acceptability or feasibility of the intervention. And then, of course, after an intervention, you can also use formative research to explore the intervention success and also any areas that should be improved, and also use it to think about scaling up the intervention or expanding it. Next slide. All right, so now that I've told you what it is, I'm going to go through some comparisons and contrast what it is not and what it does not entail. Next slide. So some of the other types of research that kind of have some overlap and some similarities, these include qualitative, quality improvement, needs assessments, evaluation research, and implementation research. So these, again, a lot of overlap and some similarities, but ultimately these are all slightly different from formative research, especially in the approach and perspective that is used, the goals and purpose, and even the scope and limitations of the different approaches. Next slide. So first, to compare qualitative research versus formative research, we will definitely get to more on this a little bit later, but really the big thing to know is that it's pretty common for formative research to include some qualitative component. So the overlap is not just doing similar things, but often they're kind of used in tandem or together. But again, the formative research is really focused on informing an intervention, and qualitative research doesn't always have that component. Next slide. So for quality improvement, that's really focused on improving usually an internal process or an outcome, usually within an organization. So there's also not as big of an emphasis on theoretical grounding. So there's not always kind of a theory that shapes how how the research study is designed or how the analysis is carried out. And because of some of the characteristics of quality improvement, it's not necessarily generalizable because it's usually designed specifically for internal use. And sometimes that also means that publication wasn't necessarily a goal starting off. So sometimes people start off with quality improvement project, and then at the end, they're like, "Oh, this is great! I want to publish it. I want to, do a conference poster." But if that wasn't kind of part of the intention at the beginning, that can be hard to do. Next slide. So for needs assessment and evaluation research, again, some overlap, but for needs assessment, really the main goal is to really understand a problem, either what's missing or what needs to change. It's really about getting a deep look into the needs of a population. So this can definitely inform formative research, but the scope of a needs assessment kind of ends once the needs are identified, whereas formative research kind of moves on to the next part and works to figure out a way to address those needs. For evaluation research, similarly, it's also pretty focused on just focused on the evaluation at the end of an intervention. So again, it could inform formative research, but it also doesn't include the next steps. So formative research really tries to move on beyond just evaluating and takes action to improve the intervention or even make a new one. Next slide. So for implementation research, implementation science, and we've been getting a lot more people interested in wanting to kind of incorporate this into their research study designs, which is exciting. But they end up coming to the formative research team, and again, similarities and overlap, but this is sometimes a little bit out of our scope of expertise. And implementation research really focuses on the uptake or the implementation process itself. And similarly, it can definitely inform formative research, but it's still kind of limited in the scope of what it's looking at. And there's not a whole lot of room for kind of the exploration and discovering new concepts or ideas that can be incorporated into formative research. And then I'm going to end my segment with a quote from one of our other colleagues on the formative research team, and she sums it up pretty succinctly. And she says, "Formative research plays well with and also borrows from other types of research." So hopefully this kind of gives you a better idea of how to think about formative research alongside some of the other research approaches. I'll hand it back over to Emily, who will talk a little bit more about actually going through and conducting a formative research study.
Thanks so much, Nick. And in reality, there is a lot of overlap with formative research and some of these other disciplines, as you've seen, but with really the intent of designing, creating a program that could eventually become an evidence-based program, but putting all those perspectives and pieces together in that creative process of coming up with a new program that's responsive to a population's needs. How do you go about doing that? Determining a starting point is actually something that people often don't give as much thought as they could. The first thing we always make people do is conduct a literature review, and it can sound obvious, but there is, no matter what you're doing, there is something out there that has been related and gone before you. And knowing the literature about what programs have tried to address the same problem in a similar population can really help you then build on the strengths and weaknesses. Maybe there's already an evidence program that looks great, and then you go into implementation research and you look at how to roll it out in your population. But if you're finding that there still is some gap, there's a need for really a new program, a new manual, a new creation, taking what was learned from previous work is the first thing you have to do so that we're not all reinventing the wheel. You might find components of things that have gone before that can be adapted into your community. You might find things within the community that aren't necessarily reported in the scientific literature, but that your patients, community members, whatever population you're working with has some ideas or even small approaches that they have tried, and seeing what has worked and what challenges there have been in those can really help you determine, you know, how much of this program do we have to start from scratch and design, and how much can we borrow and learn from things that have been tried in the past. Think very long term as well. So embarking on formative research is a hope that your program eventually becomes an evidence-based practice and that it can be disseminated widely. So formative research projects, sometimes we go through them and we come up with a program, it gets to a pilot and it still needs adjustment. It gets to the next stage and then we're finally able to test it. If that long haul is not something that you're dreaming of, then you definitely need to think about, you know, what kind of research you want to do and why, because formative research really is hopefully putting you on the path to designing a new intervention that can one day become evidence-based and be disseminated more widely. So some common methods of formative research. With individual participants, doing interviews and surveys. So more quantitative surveys are typically part of it. With a group of participants, we do a lot of focus group discussions, group interviews that look a lot similar to focus groups, but the difference is it's with an established group. So with an established, you know, community advisory board that might speak on behalf of the group instead of a mixing of individuals that are maybe coming together for the first time as they would in a focus group. Participatory methods can be integrated into all of these. And we have an amazing community engagement core at Frontiers that has a lot of ideas into that. Formative research goes hand in hand with a lot of those community engagement methods. Using observations as well is another method that we draw on a lot with formative research. This can be on a continuum of structure. So anything from field notes, from spending time in the setting that your intervention is going to be operating in, to doing spot checks or more quantitative type observations that can inform how the intervention is maybe going to work and how many people it will reach. I want to spend a little bit of time talking about qualitative methods specifically, because this is an area that our group really does have the unique expertise, and qualitative methods are almost always part of formative research. So in addition to some of the other quantitative methods that you might use in formative research, taking from the qualitative toolbox is really, really useful. And I think of qualitative research methods in terms of an upper tray and a lower tray of the toolbox. And this upper tray is kind of what everyone sees, and it's the visible part of the process that you might think you know about qualitative research methods based on that upper tray. But the lower tray contains a lot of essential tools that are really behind the scenes, and you can't really excel at qualitative without those lower level tools. And to give you a little bit of an idea, you know, qualitative research, people think of interviews, focus groups, observations, and they think of coding that data, which is absolutely the things that we do. But underneath it all, having tools in different analysis methods, in different paradigms or epistemology. So what is really the perspective or the lens that you're looking at the problem through? A theoretical perspective is another way to think about the lens that you're looking at the problem. Carefully thinking these things out puts your qualitative research in a more focused and more rigorous direction. There are different methodological traditions. There are key concepts that help establish the rigor of qualitative research that's different than how we establish rigor in quantitative research. I don't have time to go over all of these in depth, but it's really to show you that learning about the lower trade tools or partnering with people that have expertise in that area is really crucial to be able to carry out the upper trade tools in a way that will give you rigorous findings. Some people, comparing quantitative to qualitative, there's a lot to consider in terms of if you're designing formative research, how much do you want to rely on qualitative? How much do you want to rely on quantitative? And how much do you want to mix those two together as you're designing the methods for your formative research? Most people think of qualitative versus quantitative in terms of that second to last row, numbers versus words. That's the data we're producing. But the way we go about it is often very different too. Qualitative really benefits from having an emergent exploratory design, and it can be sometimes uncomfortable for folks that are more used to a fixed and confirmatory design that we often see, or we should see, in quantitative research. Qualitative research is really good at generating hypotheses. It's not very good at testing hypotheses. So depending on your intent there. And the approach is different too. We are not claiming that we can measure or test, but we can observe and interpret. We typically do that with a small and purposeful selected sample instead of a large representative randomly selected sample. Our data is less structured, but it has a rich context. And our analysis seeks to interpret the data, not merely just summarize it. So qualitative research is more than just what we can use in formative research. Formative research is what we're here to really talk about today. And it's something that if you're writing grants for NIH or any other organization that wants to help you get your pilot program off the ground, formative research is the methodological tradition that you want to write in. But qualitative research on its own can produce a whole host of other things. Doing qualitative research can give you just, an in-depth understanding of what's happening with important perspectives, the patient perspective, the provider perspective. Even if, you're not necessarily to the point where you need to intervene and take action and have a new program, getting that rich understanding of perspectives is valuable qualitative research on its own. Explanations for quantitative data. Our team often comes in to partner with teams that have interesting quantitative findings and need to get the story behind the numbers. Some qualitative methods in analysis can really produce a new framework, a new conceptual or theoretical explanation to explain a phenomenon or guide future inquiry in the area. So qualitative methods are so versatile, and there's a lot you can do with them. With recommendations for an intervention, if that's your main goal, those are the qualitative methods that you want to design within formative research. So thinking about all of these different potential products of qualitative research is useful too if it's methods that you're interested in, and it's not just for the purposes of designing or evaluating an intervention. Going back to formative research, though, the results of formative research can give you a lot as well. The results of formative research not only can give you what might be the behavioral content of the intervention, the content of the program, the form of service delivery. It can also help you strengthen the process of community participation, identify, if you were to pilot this program, or if you are piloting this program, what are the essential roles you need for people? How can you make sure that you've empowered the voices of people that are going to be part of this intervention? Formative research helps make sure that we capture those voices and try to meaningfully work them into the intervention design. Sometimes it gives you the right framing, the right language, the right delivery mode for your intervention. So moving from the methods that you use to collect the data to then getting those recommendations and those key points for designing an intervention is how we go about thinking of our analysis and thinking of those later stages of moving from formative research to the program itself. In disseminating formative research, we often use this as pilot data. So making a strong case for a larger grant where you do want to pilot or test the program, formative research can feed into that and make the case that your program was designed based on rigorously collected input from all of the different stakeholders that matter. We can also disseminate formative research in conference presentations or publications. Conference presentations are actually a really great way to get that expert input from other people about an idea as you're in the formative research stage before it gets off the ground. And it can also be a way to disseminate ideas that may or may not have made it off the ground. We do a lot of formative research, and not every single project turns into an eventual evidence-based intervention. But through presentations and publications, sharing our findings helps those ideas really inform other ideas that might be happening in the larger scientific community. Advocacy is another form of formative research. So often when we do projects here in Children's Mercy, we hear a lot of comments that really directly relate to patient care here within our hospital walls. And while they are important for a program that might eventually be designed and tested on a larger scale, they're also important for, what's going on right here and now. And we've often used that for advocacy to change technical guidelines or policies. You can also, use this on a larger level to advocate for resources and support for what you need for your program or what you hear is needed from your participants. So I'm going to take the next few minutes to show you how formative research can lie all the way on this path to having an initial idea or seeing a problem and establishing an evidence-based intervention. This is how we typically see this lifespan of research that eventually ends up in an evidence-based intervention that people can disseminate, implement, and really does have meaningful health outcomes. The first type of formative research that we often engage in is exploratory formative research. And these projects really are about understanding the problem and understanding past efforts to address the problem. They might not be moving towards the recommendations for the intervention in a really formed way, but they're getting you on that path. You're starting with the problem and you're exploring how one might go about addressing it. Targeted formative research is you do have an intervention design and all of the little components of it. You're starting to generate ideas and recommendations. You're starting to go to people and exchange ideas. And really, by the end of that targeted formative research, you want a blueprint for how you're going to go about launching your health program. Then you can do that in a pilot intervention study. And that's always an exciting time to do formative research. Understanding acceptability and feasibility of the intervention once it's actually off the ground, those goals often do overlap with implementation or evaluation research, but they can be considered formative research. If you're first piloting, you don't have effectiveness, you're still maybe making changes to the intervention, but the the benefit is you have something that's actually out in the world working and people are experiencing it. So the formative research that you conduct at that stage can really understand how acceptable it is to people and how feasible it is. If you're lucky enough then to get to an effectiveness trial, your main outcomes are really the focus of that research. Is it having some meaningful impact on the health problem that you're seeking to address? But formative research can be embedded in effectiveness trials as well. There's always some more that you can learn from qualitative, quantitative methods that seek the voices of the people that are experiencing this intervention. So formative research conducted within evidence-based trials can identify areas for refinement. So you might still even be tweaking this intervention and identify areas that you can expand it to other related issues, other populations. So formative research can really set you on the path to an entire career if you keep on developing and refining an idea and being responsive to different problems and different perspectives around it. I'm going to give you an example from my own work, which is focused on HIV testing in Uganda. A project or a line of research that I'm currently engaged in is seeking to establish evidence-based communication strategies that will encourage individuals to respond to invitations for HIV testing in clinics across Uganda. And looking at where we started, this exploratory formative research, it actually happened within a larger project. It was an RO1 for another issue where we got a supplement and wanted to just explore a new issue that was coming up. And the research questions within that were very much about understanding past efforts to address the problem and understanding this problem of when we send invitations for partners of people at risk for HIV to come in for testing, what are some of the barriers for them coming in? What strategies have been used in the past? And what really does motivate people to come in that we might be able to capitalize on in a communication intervention? So we conducted that exploratory research. We used qualitative interview questions embedded in a larger related clinical trial. So this was a small study. I think we conducted a couple dozen interviews with patients and providers, but it gave us that foundation where we understood the starting point a little bit more of what we had to do to then potentially create some intervention ideas to address the problem. We moved on to targeted formative research, where we started to get an idea of the different message framing that we might use to design a communication program to encourage partners to come in for HIV testing. So the research question in this targeted formative research was, how can new messaging that focuses on what motivates partners be implemented within existing clinical programs? One thing that we explored in the targeted formative research was this idea of gain framing or loss framing. Which of this message framing, and these are concepts from health communication that when we searched the literature, it was like the jury was still out. We still didn't really know which of these styles of framing messaging would resonate with our population. So we did some targeted formative research. We knew some of the communication elements that we needed to include in this communication campaign, but we didn't know what framing would resonate best. So we were a little bit more targeted with, we have some ideas of what we're going to do for this communication program, but we still have some open questions, and we need to get the ideas from the patients, from the partners, from the providers on the framing of the communication. We actually embedded a small randomized trial within this targeted formative research. This isn't always possible, but when it is, it's often helpful so that you can get people to experience a little taste of what you might be building in the future. What we did is we had phone scripts that were connected to the invitations for partners who were coming in for HIV tests. And we systematically varied them to test the different framings and got responses through that. It wasn't powered as a randomized trial in the sense that we could look at outcomes, but we were able to test a little part of an idea in different places and learn from that experience. When we got into piloting our intervention, the research questions that we were focusing on are, okay, we learned from our first target that the gain framed messages were preferred. How can then we package this into an intervention and really make it acceptable and feasible? This was the work that we obtained an R34 to conduct. And the thing that is really cool about the R34 is it's often a 3-year pilot or feasibility or formative research trial that can allow you to do a lot of this targeted and pilot work, allow you to integrate formative methods and really get your intervention solid before it goes off to an RO1 and becomes hopefully an evidence-based intervention that you're powered to test. So we were integrating some methods within a small randomized control in the pilot study, but really still with that main goal of understanding intervention acceptability and feasibility. So if you are designing an intervention, I really do encourage you to look at our 34 options. Formative research is really highlighted in there, and it allows you to do that work to really establish acceptability and feasibility, iteratively make changes to your intervention, and ensure that you have rigorous formative research data that makes that intervention promising for testing on a larger scale. These are some of our intervention materials, the gain frame communication that we're launching in these clinics to try to encourage partners to come in for testing for HIV. And we're gearing up for an effectiveness trial. So this would hopefully be an RO1 where we could identify if this program is effective, but still conduct some formative research in there in case we need to refine it based on outcomes, and in case we need to, in case there are opportunities to expand it to address other populations or other issues. So I'm sorry I'm going a little bit fast through this, but I wanted to make sure that I have time to hand it off to Evelyn Donis de Miranda, who is going to show a few more examples of formative research from our work. Thank you, Evelyn.
All right, thanks, Emily. And so yes, like Emily mentioned at the beginning, I have been with Children's Mercy for over 6 years now, and I had the opportunity to participate in many research projects that have engaged, especially the Spanish-speaking population. And in this example here that Emily is showing on the screen, this project was basically to identify why a food prescription program had minimal success. So basically, parents of children who have been seen at the Children's Mercy clinics, they receive it was some type of voucher or a coupon that they could redeem at a specific locations to get fruits and vegetables. Unfortunately, it was not very successful as only a few parents were redeeming these vouchers or coupons, right? So the former research team came on board, to help the team identify why it wasn't successful. So ultimately, the former we collected a lot of information that could assist the team in improving their future strategies, right? So we were able to complete a total of 8 focus groups, and 2 of those were done with Spanish-speaking families. It was very important for us to engage the Spanish-speaking community because they made a lot of the large population of the patients who received this type of coupons, right? So that was one of our goals, to engage this community. Next slide, please, Emily. Thank you. So by doing the focus groups, we came to the conclusion that there were many reasons why the food prescription program had minimal success. Our findings were organized into teams that help us understand main barriers to fruits and vegetable consumption in food insecure families. So the teams that we identified were affordability, which referred to anything related to lack of money to buy food, high prices. The second theme was accessibility, which focused on the lack of transportation. For the parents, they were not able to get to the location. And also there was just limited groceries where they were living. And the last theme that we identified was the desirability, which is, child's eating habits or behaviors, and, those cultural barriers that we notice among the parents. So these teams and the participants' recommendations gave us a framework for understanding why the past programs was not successful, and how future programs could be successful to help the families. And then one sub-theme that I would like to emphasize are the cultural barriers that we identify, specifically because we engage the Spanish-speaking population. And I feel like if we hadn't done that, we would not be able to get this information on the cultural barriers. We were able to publish the results, so findings could inform future work at Children's Mercy and beyond. Okay, thank you. So the recommendations that we identified during the focus groups help develop a new intervention. So instead of giving a voucher or a coupon to get food, the principal investigator, in this case, Laura Plechner, a pediatrician at Children's Mercy, created a delivery program that would provide fruits and vegetables to families. The program was designed to address affordability and accessibility and desirability. Our team was able to partner to gain helpful information, on the experience of those families that participated in this new program. So this time around, we were able to complete 15 interviews with parents, also including English and Spanish speaking families. And the mixed methods results showed that families were able to save money, which relates to affordability. They were also able to increase more fruits and vegetables, which relates to accessibility and desirability of our model. And, we also had got some recommendations, for future programs and things like that. So I think this just speaks a little bit about how formative research was able to help inform, a previous program and help build a new one. Okay, and I'll turn over
Thank you
to
so
Emma.
much. Thank you so much, Evelyn. I am going to wrap it up by sharing some more examples of our work. I hope there's a lot that formative research can do, and I hope today gave you a little taste of that and you can think about it in your own work. We have been privileged to collaborate with a lot of different types of research teams working on lots of different issues in both formative research, helping to generate ideas for developing a EHR screening and community referral system for physical activity and nutrition, for increasing access to sexual health care among adolescents in Haiti, preventing unintended teen pregnancies among Latinx teens in rural Kansas. These are just some examples of research teams that we've partnered with to help do the formative research that's really then become intervention recommendations. We also do a lot of other qualitative research that produces other things. The partnership that we have with Genomics Answers for Kids often focuses on understanding ethical, legal, and social issues in different pediatric genomics advancements. We're working on mapping a community health referral process and making a framework to better understand how community health workers best function. Understanding residents' experiences and novel curriculums in Children's Mercy has been some really neat work that often is that qualitative research that helps understand quantitative outcomes. These are just some examples, but I wanted to leave with resources about how you can learn more about formative research and potentially work with us in getting your own ideas off the ground with formative research. Our team works through collaborations, which are funded projects that fund our team to really get in the dirt and do that formative research, design data collection with you, but we also do technical consultations, and those are open to anybody in Frontiers. You can find us on our webpage, and if Nick's still on, I'd love you to put that in the chat. We have an external web page. There's a link to a REDCap form in there that if you want to do some consultations with us on your project idea, and if you're considering formative research, you can find us that way. The big last plug I'm going to make is for our skills training. We have 2 skills trainings that we alternate years. In even years, we do a formative research skills training that helps you design studies that inform health service and behavioral interventions. And we do a qualitative research skills series that's really about the skills you need to collect and analyze qualitative data. That is the skill series that we're preparing for in 2025, in just a few months now, up in February. We have 5 consecutive Tuesdays from 12 to 1:30 for the skills series, beginning on February 4th. It's here at the Children's Mercy Research Institute, but also virtual, and we invite anybody from other institutions to join us virtually. You can register with the link that's in the chat. There's a QR code here, and you're welcome to contact us for more information through our website on those skill series as well. We have recordings from both formative research and qualitative skill series in the past available, and I think I'll leave it at that. I would love to take any questions at this point, or field them to Evelyn or Nick.
Thank you. That was a really great presentation. Lots of great information, and I learned a lot myself. So we can open it up to questions from the audience. If you want to put your question in the chat, or if you're on and want to unmute or raise your hand. Let's see. I don't see any yet. So I can ask a couple of questions. So you mentioned that you can integrate formative research kind of anytime within your research process, but is there a better time? So is it best to kind of start with that and then go into your intervention, or how does it work if you already have an intervention that's being tested and now you want to integrate formative research methods?
That's a great question. Thanks so much, Bridget. And I think I went really fast through some of the slides that could have gotten a little bit more in. So I appreciate the opportunity to expand more. Majority of the time, we work with the idea phase, the pre-implementation, pre-pilot study, and really getting all of the ideas vetted by the people that would be involved. That is probably the most typical way the term formative research is used. But that wider definition of using it kind of during implementation or after implementation, we really do encourage. The example that Evelyn gave, this was actually a project that kind of jumped into the pilot without doing formative research on the front end, and it wasn't all that successful. So it's never too late to do formative research. And the formative research that we came in and did, it really bridged the question of why did the last program not work as well as we hoped, and what could we do in the future? And then, as you saw, they took those recommendations and they did something similar but very, very different than their first pilots. So that's one way. It can be done after something has ended and you want to sort of go back and revise and see what you can do to make it better next time. The other thing that I think is really exciting about embedding formative research into larger trials is if you have something that does have momentum, does show that it's working in certain areas, but there are parts of it that can be refined. So with the example of what we're doing in Uganda, we have a communication program that's trying to get partners to come in to be tested for HIV. Some of the communication materials we have learned are not really resonating with youth very well. But they're working really well for people that are in committed relationships or people that are trying to have children. But young people need something a little bit different. So while we're testing something for one population, we're also asking questions. What can we take from this program that would work with the youth and would work with the other population? And what more would we need to do for the next program to really address this need of another population? Taking an intervention and moving to a different setting, or trying to work on the one component that maybe didn't work as well as you can. Those are all formative research questions that can be embedded in larger trials. They often have some overlap with implementation science, but if the question is really geared to coming up with new program content, revising it, or making that program content more responsive to a community, a new community, that's where formative research questions can always sort of be built in on any scale throughout the process.
Thank you.
Thank you.
I don't see any other questions in the chat. Let me check, see if there's any hands up real quick. I don't see anything else. The other question I had was when someone comes to your team and they're wanting to implement formative research, you mentioned you need to do a thorough literature review prior, but what else do people need to have done or to come to you with to kind of get started?
Thank you for that question too. That's a great, another plug for a literature review is determining a starting point. But we do often have our first consultation with a team as being a brainstorming session. If you do want to potentially do a consultation with us, the link to our REDCap form will have you put details about what stage you're in. Is this brainstorming? Are you already kind of, up and running? Are you applying for funding? Knowing where your starting point is, we can absolutely meet you there. Our consultations are limited with our time and resources, but they are free to kind of get you started about where you are. Our skill series is the other resource that I would plug again. I think people that have taken the skill series, it is kind of a fast crash course of only 5 sessions, but it will give you, I think, good ideas about how to go about choosing methods, framing your research questions, designing a study that is both feasible and able to target the goals that you want to for the stage that you're in. So definitely, if you're still in the brainstorming session, it's in the brainstorming stage, you can come to us for a brainstorming session, but making use of our skill series and any of our other resources can help move you down the line a little bit more.
Okay, thank you. Yeah, and those links are in the chat for the skill series and the website where I assume you can get to the REDCap from there.
Yes.
Okay. Okay, any other questions out there? Last call for the audience.
Nick, Evelyn, do you have anything to add for any of the questions or any last comments?
I think we cover a lot of information, but yes, I think that I guess the only thing that I can say is if you're thinking about you're doing your own research project, just think about the community that you are going to be doing the research with and try to think ahead of what you might need in order to be successful in engaging that community.
Great point.
Yeah, I think the only thing that I would add, again, kind of talking about the skill series that I think is a really helpful thing to be able to offer as a resource. So we do it live, and it's really valuable to participate like in the course as we're teaching it, because you can ask questions as they come up. You can kind of work through some of the examples. But if you aren't able to attend live, we do also record them, and we have a couple years prior skill series for both the formative research and qualitative skill series. So those recordings are available on our website as well. So if you're interested in learning more about either formative research or qualitative research, you can go to our website and you should be able to access some of those past recordings, and that can be a really cool way to learn more about the 2 different research processes. So, but yeah, I think that's it. Thanks so much for having us.
Great, great. Thank you. And yeah, we really enjoyed your presentation, and thanks everybody for joining today. We'll give you about 6 minutes back to your day.
Thank you so much for having us.
Thanks.
Bye, everyone.
Bye-bye.